created under the Portuguese National School Health Program, aiming to construct local health plan 2017-2020, conducted by the Public Health Unit where I come from. They are students from two territories of Alentejo Coast, Alcácer do Sal and Grândola, and now they did the project. Let's listen to them.
Our project lasted from May 2016 to April 2017, and it involved a great amount of people, from students to health professionals, teachers, and local authorities who supported this work's purpose. And maybe you are asking yourselves what is indeed the purpose of our project and why it required so many people. Well, our main goal was quite simple. We wanted to answer the question, do our community health promoters share the same point of view as children and teenagers? By answering this question, we aim to give our contribution to the community and including the opinion of our age range in the local health plan.
So last but not least, we are going to talk about the visits we did to our cities and towns and the results and conclusions we got. So the first problem we have is the lack of equipment's maintenance. A possible solution for this is to recruit more staff or to reorganize the existing human resources. Another problem is that we have very degraded equipments which compromise the health of both children and teenagers, especially in schools and children's playgrounds. The solution here seems pretty obvious. We need to recover and or reconstruct these equipments. And last, we have the vandalization of equipment by some students. This is a special case, so we think that it's important to implement more classes about citizenship to promote both social and personal skills. So here we have some pictures that illustrate what I mentioned above. And outdated resources, which results in, I didn't pass this. Which the possible solution is acquisition of new, better and upgraded technology to meet the needs of the users. Regarding human resources, we found a lack of auxiliary personnel thanks to the high demands on surveillance and keeping the work area tidy and hazard-free. For which the possible solution is the increase of personnel. During the summer, the weather is really hot, so there are not enough drinking fountains. Plus, as you can see, these areas are not adequate. So the possible solution is the construction of drinking fountains suitable for students, kids, and adults. The lack of awareness regarding proper disposal of dog excrement is notorious. So we should implementing awareness campaigns and creating suitable spaces. In the most diverse places, public spaces, there are not accessibility for ulcers, so we should work on that as soon as possible. The last, in the whole Alentejo coast, with exceptional seams, there are less really short and plus cycle roads.
The problem we came across was the absence of a Department of Childhood. We needed to gather a lot of information for our project about kids, and we couldn't find one person that knew half of the information we needed. So we think it's very important to create a department that just has people working to improve kids' lives. Also, we need more safe outdoor places that really attract kids to get out of the house and out of the internet. But to conclude, let's go back to our initial question. Do our community health promoters share the same point of view as children and teenagers? We think so. When you look at the specific features of Alentejo Coast, you can see that a tremendous effort has been made in the last decades to provide all children with more developed, safer, and environmentally sustainable cities, towns, and villages. We came across lots of activities we weren't even aware of, and we suggested new strategies of divulgation of these activities. And we've seen that in that aspect, divulgation, and in others we've talked about. Things have really improved since we presented this project for the first time. In some schools, this project is even being replicated. However, there is still something that needs a lot of work, and that the princess talked about in the first day in this Congress, and that a lot of people have been talking, and that is the respect for kids' opinions. That still needs a lot of work, because at least in Portugal, school teaches us very well how to memorize things. It forces us to think things in a determined way, when it should instead give us the tools to think for ourselves, to have critical thinking. Because if we want to improve kids' lives, teens' lives, perhaps we should start by asking them how we can do so. Thank you very much.
Thank you for the presentation. We saw for the school health personnel, we saw a decrease from 2010 to 2014. Do you know why this was? Was it a lack of personnel or a lack of finances, or what was the cause?
It's not lack of personnel, actually. It's just like governmental stuff, political stuff. Because the problem is that the number of doctor appointments reduced, and so did the health technicians working at health centers. But that doesn't mean that people's needs change. It doesn't mean that people need to go less to the doctor, you know? So that's a big problem.
I am Lucas from the Netherlands. Amsterdam. Obrigado. I really enjoyed your really fresh approach to going out and looking around and see what the problem is and what's better. I was wondering, what's the biggest change that you made? Did you make changes?
See, here, you have a ramp, but the problem was the sidewalks didn't have one, so you couldn't access the ramp of the court because you had no ramp in the sidewalks. But after we did this project, it was quickly solved. Also, this library is it's being reconstructed, and there are other examples. This park is also being reconstructed, and we hope there will be more dog toilets there. I don't know. Slowly, the things are improving.
And question? Can I ask you a question as well? It's very practical changes from things that you pointed out in your research, but in the end, you already also said. Children's views should be more implemented in politics and the things they look at. Is that being done a little bit more than before your project?
Yeah, slightly. After we talked about this and the lack of divulgation, at least in Grândola, there was created a website that wants kids to give their opinions about how things can be improved. So slowly, we're participating a little more.
That's nice, thank you.
In your investigations, you showed that a lot of parents that have little education, they didn't motivate their children to have an education. Did you do anything about it?
That's kind of hard to do because you need to change the system. This is not like, as I said, this goes from generation to generation. It's not something that you can just change, but that's a good idea. I think we should talk to the schools and maybe do some kind of thing in school that pushes parents to participate more and care more and know more about their child's life at school, because I think that's the problem. They don't really know what their children are doing at school, so they don't care.
Okay, I think that ends up in a nice new project for you to do. Thank you very much, and thank you for your presentation.